Taiwan reported another 26 COVID-related deaths on Monday. 3 of the people who died had developed symptoms only 3 days prior. Another 3 were asymptomatic when they tested positive. The new deaths reported took Taiwan's total to 286 and the overall COVID mortality rate to 2.4%, higher than the global average of 2.15%. To bring the death rate lower, health authorities have announced measures such as stockpiling Remdesivir. Remdesivir works by blocking one of the key enzymes of the coronavirus, which is needed to replicate the virus's genetic material. This in turn prevents the virus from multiplying, making it a drug that may help patients with severe symptoms.
So far, Taiwan has registered 286 COVID deaths for a mortality rate of 2.4%. That's higher than the world average of 2.15%. Experts say that old age and chronic illnesses are factors at play.
If you only look at the death rate of patients 60 and older, the death rate is even higher. It is clear that our medical capacity is becoming somewhat exhausted. Look at how many people are dying in their homes.
The CCC has announced 4 measures to try to bring down the mortality rate.
Of course, we have to try to bring the death rate down. On the preventative front, we of course want to make the vaccines available to older adults once frontline medical workers have mostly been vaccinated. The second strategy is to bolster our defenses by buying monoclonal antibodies for patients with mild and moderate symptoms to prevent severe symptoms. Thirdly, we are stocking up Remdesivir to give patients with severe symptoms the best medical treatment. Fourth, we've also asked experts to convene discussions and review policies to see whether there are ways to provide better care. There are several foreign firms whose monoclonal antibody treatments have already obtained EUA from the US FDA. There is evidence that shows that administering these in the early stages can reduce the severity of symptoms and the need for hospitalization. Monoclonal antibodies are most effective injected early on, when a patient starts developing symptoms. And prioritizing older adults would be the correct way to act, as older patients can often develop severe symptoms.
As of Sunday, there were 264 COVID patients on respirators and 2 on extracorporeal membrane oxygenation. The CCC has also announced the purchase of 200 high-flow nasal cannula devices, which are as effective as ventilators, to increase oxygen supply to patients.